I'm Matti Aapro. I'm a medical oncologist and representing here UICC, the International Union for Cancer Control.
My name is Etienne Brain. I'm a medical oncologist working in Paris at Institut Curie, and I'm representing here SIOG, the International Society of Geriatric Oncology. More than 50% of our patients with cancer very soon will be over 65 or 70. So because of this large volume, certainly there are economical issues and that we need to get ready, prepared to handle that correctly, adequately.
WHO's initiative of the Decade of Healthy Aging is extremely important, not only related to cancer and cancer incidence in the older people, but all the other diseases. With the importance of WHO in the conversation with governments, we have here an open avenue to talk to those that at the end will have to make the decisions in most countries. I think the first one that always comes to my mind is bias, bias, and bias. Instead of looking at the reality of the person which is in front of us, we and the patient and those that are around the patient, we have our biases.
I think we are very often trapped by bad habits or things which we are used to. And the best example for me, the best illustration, is that when you compare the decision taken without any approach on the evaluation on the geriatric aspect, you take often wrong decisions, and you can correct that if you implement a bit of geriatric assessment in your treatment decision-making process. The question of how the family interacts, helps and supports the patient is important. Isolated patients with secluded ones with no help, that's a major factor that we find in many studies for badly tolerating the treatment or having not a good organization around the patient.
They need the caregiver. We forget that our older ones often will face issues simply in transportation to the doctor or remembering which drugs to take in which sequence. All things that for the middle-aged people are easy to handle. And there we need caregivers, not specifically professionals. We can rely on friends and families. It's not only a campaign to emphasize an important question, but it has behind it the possibility of actually real actions that will deliver in 1, 3, 5 years results that will modify the outcome of cancer in some of our older patients.
Probably the main endpoint or primary goal is to bring some consideration to this segment of the population, wrongly treated or badly managed, and to show that we can do better, much better, much better.